Hi there, friends. Welcome to K.Typical, where we talk about solving atypical problems with logic and technology. Today's topic is a real pill to swallow, pun intended. It's medication non-adherence, an undiscussed danger for those of us with ADHD. If you're like me, you've probably tried every trick in the book to remember to take your meds, from using a pill organizer to leaving notes around the house, to bribing your partner with chocolate to remind you. And yet somehow you still manage to forget or lose track of your medication regimen. Today, we're going to be taking a closer look at the bigger picture and problem, exploring how common medication non-adherence is, the consequences we all face from this problem, and proven strategies for improving your medication adherence and supporting a loved one that might struggle too. Fear not, forgetful friends, because today I'm sharing my personal journey with medication adherence and some of the tragic and delightful ways I've tried to stay on track with my meds over the years. So grab a glass of water, put on your favorite funky socks, and let's tackle medication non-adherence together. We've got this. First, let's talk about what medication non-adherence is. According to the American Medical Association, medication non-adherence is when patients don't take their medications as prescribed. This can include missing doses, taking doses at the wrong time, or stopping medication altogether without consultation with a provider. Medication non-adherence is a significant public health concern, and it's associated with negative health outcomes and increased healthcare costs. While in-depth study and analysis of the problem is still lacking, it's estimated that up to 50% of patients with chronic conditions are not adherent to their medication regimen. And this can mean life or death. While the number of deaths related to medication non-adherence is not well established globally, it is well established that medication non-adherence can have serious health consequences and can increase a patient's risk of hospitalization, disease progression, and mortality. One study in the US, published in the Journal of Managed Care Pharmacy, estimated that medication non-adherence was responsible for approximately 125,000 deaths and at least 10% of hospitalizations in the entire United States each year. The study authors went even further to estimate that medication non-adherence resulted in an additional $100 billion to the country. These statistics highlight the importance of medication adherence and the need for effective interventions to support patients, and I mean people like you and me, in maintaining safe and healthy practices in medication adherence. But why is this such a big problem for me and others with ADHD? As someone with personal experience struggling with medication non-adherence, I know how challenging it can be to remember to take medication as prescribed, especially when juggling a personal life, family, significant others, and a job on top of your chronic conditions. One of the reasons that I've personally struggled with taking my blood pressure medication is that I don't feel the effects of my high blood pressure or the treatment. For years, I've tried every trick in the book to remember to take my blood pressure meds as prescribed. I've used pill organizers, pill packs, phone apps, and even strategically placed medicine all around my house. But despite my best efforts, I still found myself forgetting to take my medication or taking it at the wrong time. As someone with ADHD, I know that executive functioning skills like time management and organization can be a real struggle. But I've also found that the medication I take to manage my ADHD symptoms can sometimes make it even more challenging to adhere to my blood pressure medication regimen. But over time, I found some strategies that have helped me stay on track. For now, I'm trying out a robotic dispenser technology to help me simplify my doses and schedule, along with reminders from the robot and on my phone. I've also found that using a pill organizer or setting up smart reminders using your smart home assistant like Siri or Alexa, and incorporating these medications into your daily routine, like taking them before breakfast or before bed, it makes it easier to remember to take them. Of course, I still have days where I forget to take my medication or struggle to stick to my regimen. But by being mindful and proactive about my medication adherence, so far, I've been able to reduce the frequency of missed doses and better manage my blood pressure. But if you are like me and you're not feeling the effects of your condition, it's important to take your medication as prescribed. I know that uncontrolled high blood pressure can increase my risk of serious health complications like stroke, heart attack, and kidney disease. I also need to act like I know that sometimes. For blood pressure medication, one thing that I have also found useful is to focus on the long-term benefits of managing the condition. It's important to find strategies that work best for you and to seek support from your healthcare provider and your support network if you're struggling with medication adherence. So there you have it, friends. Medication non-adherence is a real issue and one that affects millions of people worldwide. It's a challenge that I've personally faced and one that I know many of you have struggled with as well. But the good news is that there are solutions out there, from pill organizers to smart reminders to robotic pill dispensers. There are tools and strategies that can help you stay on track with your medication regimen. And if you're struggling with medication non-adherence, know that you're not alone. Don't be afraid to reach out for support from your healthcare provider or loved ones. Together, we can tackle this challenge and prioritize our health and well-being. Thanks for joining me today, friends. Remember to take care of yourselves and each other, and until next time, keep being your awesome, atypical selves. This is Kevin, and you've been watching K.Typical. Do you struggle with your medication routine? How do you keep yourself on track? Leave a comment below so we can all stay healthy together. Like and subscribe for more content, and to see Kevin's unboxing and review of the robot medication dispenser. Coming soon.